Welcome to PodMind, where we explore the intersection of data science and mental health research, policy, and practice, and incredible people driving change in this space. PodMind is brought to you by DATAMIND, the UK's hub for mental health data science. I am Marcos del Pozo Banos, Curated mental health data co-lead for DATAMIND and senior lecturer on mental health data science at Swansea University Medical School. Today, I'm very pleased to welcome Dr. Pauline Whelan, Founding Director and Chief Operating Officer at Careloop Health and Digital Advisor at Greater Manchester Mental Health NHS Foundation Trust. Thank you for making up time for us, Pauline.
Thanks very much for the invitation. It's lovely to be here.
Yes, and welcome. So I was really looking forward to this, to be honest, because you have a really fascinating background, starting in computer science, like me. So I can relate to that, and software engineer. So I have to ask, was there any moment or an event or a person that made you say, right, I'm going to use my skills to make a difference in mental health?
Yeah, thanks. I've always been really interested in technology and computers and innovation as well. So finding new ways to solve old problems. I wanted to find a way really to use computer science and software engineering to do some good in the world. So for me, software engineering's always been about, how do we solve the meaningful problems rather than just any problem. And mental health, I suppose, is one of the most important areas where technology, I think, can make a real difference. And we're starting to see that in all the digital mental health tools and technologies that are emerging. So I don't think there was any one person or moment or event, but just the coming together of computer science background and interest in innovation, and then finding mental health research as a way to use those skills to do some good.
Okay, so this was always something that you had in mind, even as you enter, that the computer science training, or?
Yeah, I think I never envisaged that I would end up in mental health research. I just knew I was really interested in computers and software. But I stumbled, I suppose, upon mental health research when I joined the University of Manchester way back in 2009. And I started working with people who were working in digital mental health research, and then got hooked.
All right. No, well, I can't relate to that, to be honest. So yeah. So do you think there is like a project or two, maybe looking back, that you're most proud of? The ones that maybe truly define, as you said, you kind of stumble into this field, but maybe one that is like, yeah, this is why I'm doing what I'm doing.
Yeah, I think there's been lots of them over the years. And I should say that I worked for quite a long time in health research, so digital health research, not just mental health. So there's been lots of projects along the way. I suppose one of the key defining ones, and the one that I'm still working on in Careloop, were the early ClinTouch Careloop research projects. So they were randomized controlled trials, seeing if we could build new digital mental health technologies to improve people's lives. So obviously they've stuck with me, and I'm still working in them. So they were definitely defining projects. But I suppose the second big project, and it's not a research grant as such, but it was founding the GM Digital Research Unit with Catherine Abel at Greater Manchester Mental Health. So we set up that unit about 7 years ago. And that was definitely a defining moment because it enabled us to develop research and evaluate new digital technologies coming on stream and things that wanted to roll out into clinical services, and thinking about how could we implement these things within clinical services. And that led to a whole number of really exciting research projects in mental health and digital mental health and industry collaborations, and meeting lots of new people and people with lived experience of mental health. So I think that, for me, probably springboarded a lot of my research into digital mental health.
Great. There's so many things that I want to tell you about. But let's, I guess, you started by saying that, you have been working for quite a long time on research. So you spent quite a bit of time at the University of Manchester, as you mentioned. So is there any specific, like light bulb moment that you had in that environment that changed how you thought about like problems and it's like, yeah, this is, maybe in terms of like, this is why I've been thinking of using digital tools to,
Yeah, I think when I joined the university first, it was a bit of a light bulb moment to understand how big a digital health research project is, how many different kinds of people are involved, on the multidisciplinary team, how you work with people with lived experience, with statisticians, with clinicians, all these people that, I had very little experience of working with previously. And how do you bring people together and try and talk the same language and understand that what means one thing in computer science is totally different in somebody else's field? That was definitely, I think, a light bulb moment for me, just understanding how the world works in health research and digital health research. That was definitely a moment that stuck
That
with me.
I wanted to ask, how did you find that? Because I had exactly the same experience. So I want to know, what was your experience going through that actually of, yeah, I thought we all speak the same language, but no.
It was a bit disorienting to start,
Yes.
but it's one of the things that kept me in digital health research for so long, are those multidisciplinary collaborations, because the most exciting bit, I think, to hear a perspective on a problem from somebody else's field or discipline or point of view, that's the bit I love. There's so much learning in that. I really love it.
Great. Yeah, I agree. I agree. It's just like talking with other people. I don't know. To me as well, it has made me seeing problems in such a different way. And even the way we use digital tools now is like just, and technology in general, in mental health research, it has completely changed the way I see how we can use this technology. So I agree with you 100%. So was there perhaps any project that maybe seemed like, this is a small project that we have on the side at the time, and then, it grew up to be that massive thing, or maybe not, maybe it doesn't have to be big, or maybe it didn't have to be big, but you could tell that it was pivotal in your career?
Good question. A project that sticks with me, and didn't necessarily start off very small, but I suppose my contribution started off quite small in it. I had a small team of software engineers working on it, and it was a digital health project working to support people with cystic fibrosis. So we were building a platform to develop digital behavior change tools and supporting it with the clinical community of practice. And it started off as a research grant, and then went on to live in the real world for about another 5 years after the research grant. And I learned so much working on that project, again, from the multidisciplinary team. But I also worked for many years with the principal investigator on the project, who was a respiratory consultant in Sheffield, Martin Wildman. And working with Martin was definitely an inspiration to me, because he showed me just how much dedication and perseverance and commitment and grit and determination it takes to get things live in the NHS. And just there'll be barriers constantly, and you've just got to keep pushing through. So that was definitely a project, I think, that ended up being very important to me. There was a lot of learning, making mistakes, trying to find ways around things, and how to keep a research project supported after the lifetime of the original research grant. That was a lot of learning in that as well. So
Cool.
really enjoyed the project.
You mentioned like the barriers that you find, right? And I can understand why you say you find many of them coming from the NHS, but I think it will be fair to say that in the academic world, we have other barriers as well. And I want to now connect this with you now having moved your focus perhaps more. I don't know if I don't think it's entirely, but like definitely more to Careloop Health. And I wanted to ask you maybe what were the drivers, and whether perhaps those limitations that we face in academia were part of it, and you really wanting to kind of like, I want to make an impact, and I don't understand these barriers. Why do we have them? Let's just do it.
Yeah, absolutely. And I love research, and you're right, I still am involved in lots of different research projects. But one of the things that frustrated me with academia was, I suppose, the funding cycles and the research grant lifetimes. So I worked on an awful lot of digital health research projects that demonstrated they could be useful to people, that people liked using them, they could bring some benefit to a particular population. And then at the end of the research grant, there was never any funding or any resources to take it forward. So we built a digital product. My team was a team of software engineers and designers and project managers. And we built something that we knew people liked, could improve their lives, showed real health benefit. We had published research about it. And then it just sat on a GitHub repo somewhere, because there was no funding to take it forward and no team to bring it forward. Not because people didn't want to, just because there wasn't infrastructure to do that. And it's a very different project, taking a product beyond the research world into the real world. And lots of things just ended at the end of a research grant. And I thought that was such a pity, especially for the target population it was designed for. And that's ultimately what motivated me to move to industry myself, to see if we could take one of these projects that I'd been involved in for so long. Careloop has about 4.3 million in public funds from the National Institute of Health Research and Medical Research Council invested in it over many years. It's been going for 10 years of research. And so seeing that not have a lifetime beyond academia was just too tragic. And so trying to take it into the real world was really what motivated me to do it. And I reckoned if any of the projects I worked on could be successful and bring benefit, it was going to be this one.
Great. Absolutely. And also I imagine, based on what you have told us so far, that you have probably worked alongside patients quite a bit. So I can imagine how, just that adds to what you were just saying, right? It's like, I know this can help. And I actually have been in conversations, many conversations with these patients, and I know they want this. So why is, I can't imagine how frustrating it must be to just think that, all this effort that you have put on, but also the patients, it was going to be potentially to waste. And yeah.
Yeah, absolutely. And you do feel like you're letting the patient population down in that sense, because you've brought them on the journey with you to co-design a digital tool, to ask their input all along the way, and you get to the end of the project, and then if nothing happens, that seems a real, a disaster, really. It's not fair on anybody. I suppose you see the same thing a little bit in academia, and it was one of the other challenging things, I think, is that to put in a research grant, often you engage a lot with people with lived experience of mental health. So you ask their opinions, you get them excited about collaborating on an idea. And then if the research grant is not funded, you have the kind of horrible task of going back to people and saying, we all know it's a good idea, but it wasn't funded, and so we can't proceed with it. So these are the challenges.
I'm thinking now, what you're saying is really interesting, because in a way, I think it will have made, had you not decided to say, okay, we're going to make this happen, I think potentially the impact that will have had in the trust that patients have on research, I think potentially will have been big. Because as you said, okay, I don't know how many patients you involve in your research or in that research in particular, but even if it's just a few, they know others, and then it's just the word of mouth, right? And it will have a spread. And we keep saying we need to engage, but it's potentially the message that I'm getting in my head is like, engagement is not enough. We then have to deliver in the promises that we make.
Yeah, absolutely. And we know that's one of the frustrations that people have when they get involved in research and then they never hear about what happened. So they might collaborate on a research grant idea and they never hear, well, did that change somebody's life? Did my time and my effort and all the sessions I went to in a focus group to contribute my ideas, did that have an impact? It relates actually to another project that's part of DataMind as well now, called VoiceIn, which is a digital platform to support patient and public involvement in research. So it's an app that people can download and they can see research opportunities related to their target areas of interest, and then they can provide some input into the research. And again, that was really driven by trying to expand the remit of people who contributed to mental health research. So not the usual suspects who come to focus groups who give really important insights, but often it's the same people we see. So it's always nice to broaden that and have a more diverse population able to contribute. But it's one of those things that people constantly told us, if I contribute, how do I know what's happening to the ideas I gave and the research project and the grant if it lands? And so through the app, we hope to be able to update people. So as new things happen with the project, they'll get an update on their phone and it will say, well, this has been funded, or these are the findings of the research that you contributed to. This is how it's changing people's lives. So having that whole journey for people who take the time and effort to contribute, I think, is something that's often missing at the moment.
Great. VoiceIn, right? So is that out already, or?
It's out already. Yep. voicein.org.
Cool. Thank you. So
As well.
Careloop builds digital products to transform care for people living with serious mental illness. Do you want to explain walk us through what kind of, digital solutions you're working on, or, what is it that it's maybe almost out there? Yeah.
Yep. So with Careloop, the idea is quite simple, really. People respond to a clinical questionnaire on their smartphone daily. The data is uploaded to a central secure server that we host. And on that data, we run a relapse prediction algorithm. So we identify in a personalized way. So we identify for each individual when they might be at risk of relapsing, of becoming really unwell. And then we flag that to their care team. So it works as part of an integrated package with the healthcare team. And then if we notify the healthcare team that somebody's at risk of relapse, then the team can intervene and prevent somebody from entering crisis, which is what we're trying to do. And we've shown across multiple trials that we can do that, that people like using it, that people will submit their data, that the algorithm can identify when people are at risk. So that's what we're trying to do at Careloop. And I think the motivation really and the desire to try and improve people's lives is what motivates all of us. And future iterations of the product will likely integrate new ways to capture the data from people. So not just active questionnaires and a smartphone to be able to respond to, but obviously we've got lots of passive data out there in the world now too, so we can pull data passively from people's smartphones and wearables. And there was a related project at the University of Manchester doing just that, so pulling passive data from wearables and smartphones to fuel a prediction algorithm. So future iterations of the project and product of Careloop will take that approach as well.
Cool. I wanted to emphasize something that you said, that is that you have shown through multiple trials that you can do that. And I want to emphasize that because there is so, in the world of technology, I think there is so much, I don't know how to put it, smoke, I'm going to say, up there that, we keep saying, okay, you're publishing this paper, you're giving me some numbers, and then now you're jumping from there in your conclusions, you're jumping from there to, hey, let's implement this. Wait a minute. Right? So there is so much that I guess, and the way I see it is always like, we have, going back to, maintaining the trust with the public, so we have a responsibility to actually deliver something that, make sure that what we're going to deploy, it actually works, and that it doesn't have any unintended consequences. And there has been so many cases of situations, especially with artificial intelligence, right, where we have just lost the public's trust.
Yeah, absolutely. It's challenging, isn't it? And I think it is really the meeting of two worlds that operate quite differently. So you have the tech world and software, which moves really quickly. And then you've got health research and academia, which moves really slowly, thinking very deeply about a problem, thinking about all the safety edge cases and potential adverse events, and how do we gather the right amount of evidence and from each different angle. So it is challenging from that perspective, I think, because you've got the technology which is racing away, and health researchers, trying to slow things down and really think about things deeply. It's definitely a challenge.
Yeah. I'm getting ahead of myself, but I have to ask here now because, following up on this, it's you still are in both worlds, the academia, the research, and then the industry sector, let's say. How do you balance those two competing interests, so to speak? How do you find that balancing act?
Yeah, it's really interesting, isn't it? I think for all the reasons you said there. I think, academia and research really taught me the importance of evidence-based approaches, like you've been talking about, the value of really taking time to think through a problem, do the deep, rigorous thinking, and really understand the problem, like from a multidisciplinary perspective, like we do in lots of the health research projects. But then from industry, it's taught me, you've got to move at pace in the real world. You've got to think about how do you make things happen. So some of the bureaucratic processes that you might encounter at a university are just not compatible with trying to get things out to people and iterate things and refine things and make it really work. So quite complementary skill sets, I think, in a way, but they do kind of butt up against each other now and then.
Right. So let's talk a little bit about DataMind and your role in DataMind. And one of the things that you do is that, you want to make these digital tools all freely available for other researchers, right? And it's also like, again, I think it says a lot about you, again, in the sense of, and I guess it it goes against that myth of, all um, business is evil and all that. It's like, well, here we have you. You are doing both research and industry development, and you haven't lost track of why you're here, which you have said, really helping the patients, number one. And then the other one, we know through your role in DataMind, that is actually making these tools, available for researchers and to push research forward. So I think that's great. It sounds like again a bit of a huge mountain to climb. So, what are the biggest challenges in getting the word out and ensuring that people actually use these tools?
Yeah, it's a really good question, and I'm sure you feel some of this pain as well, but it's surprisingly difficult to get the word out, I think, and to tell people, even if you build something that is standardized and you think will benefit lots of researchers, how do you make them aware that it exists, and how do you stop people reproducing exactly what you've just done and spending, a whole lot of time and effort on it as well? I think that's why collaborations like DataMind and some of the related mental health work in the UK at the moment is really helpful, because it's helping us all network, hear about each other's stories, hear about the research that's happening, and also podcasts like this and the DataMind website. I think all those comms tools are really valuable. It's not my best skill set, in terms of how do you communicate things out and the branding and all that side of things, the marketing almost of some of these tools. But I think that's where DataMind and the bigger team really helps with these kind of things, because it's impossible almost to do it just as a single researcher. I mean, you can go to a conference and you can present about it, but really you want to reach a much wider audience than that. So I think it's these big initiatives that really help with some of that.
Cool. You also have an equity audit tool. I think that's a really fascinating project. Can you tell us a little bit about it, please?
Sure. So the equity audit tool we've been building up as part of DataMind for really since the beginning of DataMind. And one of the challenges we know is that participation in clinical trials is not always representative of either the target population or the underlying population. But we don't routinely track this data. I think lots of people assume that this tracking would be happening, that we'd know exactly, which demographics are participating in clinical trials at a national level, an individual level, or across a particular domain area. But actually that data is not routinely collected or analyzed.
Mhm.
So what we want to do is to show who is participating in trials so that we can identify where the gaps are. Is there, in terms of age, sex, ethnicity, socioeconomic status, all the usual demographic data that you might expect, but to be able to visualize this and track it and monitor it so that we can get to a situation where if you're recruiting for a study, is your sample representative of the population you want to recruit, or at a national level, we can see all the clinical trials in depression and mental health, for example, recruited this sort of sample. So it's a bit skewed, and maybe we need to, change the recruitment practices in future. Just trying to get, in the first instance, some visualization of that data and trying to encourage people to collect it. So that's the first stage of the project. And it's kind of surprising that sort of mechanism to analyze data in trials doesn't exist already, but it's being built now, so we're getting there.
Yeah. Yeah, you would have thought that was, step one. That, someone had to come and say, hey, you missed one step here. Thankfully, we have you. So we have talked, because I couldn't help myself, about the, the divide between academia and industry. But what would be, what do you think is like a practical recommendation now to, that's something also that we try to do in DataMind, is try to find ways for academia and industry to come closer together. But what would your take on this be?
I think it's something actually that we're starting to get a bit better at, I think there's more events and more opportunities now for industry and academia to come together, certainly in the digital health space. And I know DataMind's responsible for some of that in mental health as well. For me, it is having those opportunities to collaborate, to build those networks, to link people up, to have the events and with breakout one-to-one sessions and so on, where you can really get to know people in industry and academia on both sides, to have those meaningful conversations. Because I think once you get people together, the conversations naturally flow, and you realize, oh, they're doing that in industry that I was trying to sort out in academia, or vice versa, and you can start to solve each other's problems. But just finding people and having opportunities to meet them in a in a nice environment where there's time to share and understand what people are doing, I think that's really important. I know that's definitely helped me when there's been events that combine industry collaborators and academia. I've always found it very useful.
It's interesting because you mentioned about like sharing, and I think also there is this misconception that industry doesn't share because it's against their nature to share. But I don't think that's, I don't know, I may be wrong. You tell me, but I think they do share. Because it's what you're saying about, they need to share. They need to have those conversations and have that first of like kind of like trust step to say like, hey, I'm going to tell you this because I want to work with you. Is that?
Yeah, I think that's exactly right. I think I might have even had that bias myself against industry at one point in my life when I was embedded in the university for quite a while, and thinking, oh, that industry was kind of siloed and they didn't want to open up. But as soon as you start engaging with industry and talking to people, you realize they're facing exactly the same problems that you are, and there's much more power in coming together to try to solve things than there is in staying siloed. So that was definitely eye-opening for me as I started to get more involved in the industry side of things and meet industry collaborators. And I have to say, some of the industry conferences that I've been to have been some of the most collaborative spaces, and I've learned more from other people there than other conferences. So I definitely think, yeah, it's a great way to open up spaces, and industry has a lot to teach us.
Cool. I stay with that last. So to try to wrap it up now, if you could go back in time, and what's one piece of advice that you will give to your younger self, when you were starting your career?
I think it's probably to just learn as much as you can from everyone you meet, and try and be exposed to as many different kinds of perspectives as possible. That's one thing I love being at a university. I've loved that about being in a university, all the access to different, disciplines and perspectives. And I think engaging as much as possible with that when you have the opportunity to, it's just so valuable. So collaborate as widely as possible with as many different kinds of people as possible.
Cool. And if you, this is a bit of, if you weren't in mental health research, I know this is a funny one, but I think it's interesting because it tells you a lot about the person that you're talking with, right? It's like, if you weren't doing exactly this, you did say early, like, I knew I wanted to put my skills to good use, basically, to make a difference. So if it hadn't been mental health, what would it have? Like in a different life?
Yeah, that's really tricky. I think, yeah, some kind of health research or innovation, probably. I can't. It's hard. I've been in this world for so long. It's quite hard to imagine myself outside it. But definitely something combining the worlds of technology and doing some good in the world. So whether that would be, in education or something else, I think it would still combine technology and innovation in some way. Or unless somebody wants to give me, a professional tennis player contract or something.
Well, it's out there now. Thank you very much, Pauline, for making time for us. It's been great talking with you today.
Thanks so much.